Tansun med was prescribed. You showed your neighbor your med. They said this med is harmful to the kidneys. Will you keep using this medication? If it harms the kidneys, why would you continue using it? If you were given such feedback from your surroundings, would you like to use this medicine? Do herbal remedies really harm the kidneys? If it harms the lambs, why do we prescribe these medications? Are we wasting our time here? Do Tansun drugs affect dolls? Our video starts. If I were to ask you a question, think a bit. If I ask what is the most common cause of renal failure requiring dialysis globally, even leading to end-stage renal disease, I pass to the world if I ask for our country. The answer is hypertension. In other words, hypertension itself is the most common cause of kidney failure, rather than hypertension medications. People miss out on protein and develop a boric deficiency not due to blood pressure medication, but generally because their blood pressure is uncontrolled. If you know anyone around you who is familiar, ask them about dialysis, which means end-stage kidney failure, people who can no longer urinate. Why did you become dependent on dialysis? Why did you lose your kidneys? He will probably say that my blood pressure is high. While hypertension is the primary cause of kidney failure, the belief that blood pressure meds may harm the kidneys still prevails in society. They've been dominant for decades. We're coping. The patient is approaching us. Assume the BP was in the 18s or 20s, and after medication, it decreased to the 12s or 13s. This is controlled HTN and the renal risk is now minimal, but generally the story doesn't end like this. A person takes one dose of a blood pressure med, and now he believes that BP is treatable. So it goes like this. The BP is in the 18s. It falls and goes down to 16. The person never goes to the doc again. The person skips checkups, blood pressure measurement, annual checkups, and kidney tests. This continues for years in this order. Or the tension disappears in the 18s. This person eventually develops kidney failure. Upon kidney failure, medication was initiated, leading to my subsequent development of kidney failure. The mechanism below is different, not because the person started taking BP meds, but because they didn't use it appropriately. Kidney failure due to inadequate blood pressure control. Certain medications can impact kidney function. I mentioned it in my prior videos. If we have kidney issues while on blood pressure meds, usually kidney function returns to normal when the medication is ceased. Rare condition. In other words, most meds don't affect kidneys, but even if they do, we can detect it with values and change the meds accordingly. After the medicine performs its function, there are two ways for it to be excreted: liver and kidney. There is no other organ in our body that cleanses these wastes and eliminates drugs from the body. Either it will be eliminated through the liver or through the kidneys. And each and every medication has a possibility of rare adverse effects on the liver or kidneys. We already anticipate this, but we cannot take the risk of kidney failure, which involves a 50% risk due to hypertension, for a 1 in a million or 1 in 1,000 chance. The likelihood of blood pressure medication affecting the kidneys is generally low. If blood pressure is uncontrolled, the risk of kidney damage is higher. If BP meds caused instant kidney damage, if all users experienced it, if they were that harmful, would we still prescribe these medications for managing hypertension and protecting kidney health? Contrarily, patients lose kidneys due to improper use of blood pressure meds, lack of regular checkups, and failure to visit doctor. Look, this is crucial. Please do not cease taking your medication. Please do not attempt to reduce your medicine by seeking assistance from friends and relatives. Go to your doctor again. If you have a question mark in your mind, ask your doctor. Share this with your doctor, not with your friend, spouse, friend, or neighbor. Doc, I'm asking if this med will harm my kidneys. If you knew that it's the sun, not this med, that would harm the kidneys, you'd continue to use this med. We still see patients every day experiencing kidney problems due to stopping blood pressure medication. Not saying BP meds never affect kidneys. Not saying no risk with BP meds, but stopping medication poses greater risk in terms of risk-benefit balance. Our aim is to lower BP with lifestyle changes, reach a level where meds can be stopped. Here, a lifestyle change is needed. The person isn't changing their lifestyle or stopping medication. The average value is around 16s, 17th, and I don't want to use medication as it may affect the kidneys. Not true. Watch our video on how to lower blood pressure meds. I'm already telling there. At Heart 360 Clinic, we favor lowering and stopping blood pressure with lifestyle changes, no medication needed. Don't follow uncontrolled hypertension without medication. If needed, blood pressure medication is started and stopped when the new one arrives. Medications are not addictive. These medications generally do not harm the kidneys. There are people who have been harmed. There are people who show side effects when touched. There is occasionally, but not using the medicine at all is not a correct solution. Please do not stop taking your medication without consulting us. Hypertension is a serious disease. BP is a silent killer. Suicide is slow. Please don't underestimate the BP. Don't forget to subscribe to our channel and turn on notifications. Goodbye.